Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit systems of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Jenny Sutherland. Happy New Year, ladies.
Happy New Year.
Happy New Year.
Thanks for coming on. And you folks are from HospiceCare in the Berkshires. Very happy to have you here. Honored, actually, I have to say. Thank you for your work. And you are Shannon Dixon, and the clinical coordinator of the services there.
Yes.
Yes. Thank you for doing that.
You're
And
welcome.
I'm very honored. You are my first doctor. Dr. Canara Albert, thank you, Medical Director, Hospice Care in the Berkshires.
Thank you for having us.
I almost dressed up a little nicer, but then I realized this was it. So thank you for both coming on. Thank you for doing the work you do. Shan, we're going to start with you, and you're going to talk to us about the services that you all offer the community.
Yes, we offer services when people, including a person and their entire family, reach a point that they are looking for quality of life over active treatment or pursuing aggressive treatment or therapies with their physicians. We can offer services which include nursing, social work, chaplain, volunteers to help provide support and bring back quality of care and obtain their independence and their residence. And a residence can be their own home, long-term care facilities, and assisted living facilities. Our goal is to work with the family and the person to develop a coordinated plan of care so their goals and their wishes can be met, along with providing them quality and comfort through the end of life.
That's great, and I think it's interesting. You really think of every aspect of giving that person a quality of life, so thank you for doing it. And your role in that is to support the hands-on caregivers and the nursing?
I oversee all of the clinical components, including our nurses, volunteers, social works, and chaplains, and our hospice aides.
Wow.
In conjunction with working with Canaret and our community physicians to develop that team, multidisciplinary team approach to bring back the quality and the support and actually the symptom management through end of life for our families that we serve in Berkshire County.
Yeah. It's amazing to me, and I've been lucky enough to go to your office and spend time there and go out in the field with quite a few of your staff. You know, you said volunteers and chaplains and all of this. It's just amazing to do that. So when folks are thinking about hospice, is that maybe a doctor suggests that?
Anyone can suggest that.
Okay.
The person himself, a family member,
Sure.
a friend,
Okay.
a church
So and
component.
And I think that's
anyone.
why it's important to do these shows, to get the message out there that if you think someone could benefit, and not just that person, the families and friends. And I know, Dr. Albert, you play a big part. I have thought it was really interesting to see you at meetings, hearing about you talking about the different patients that you have on hospice, and your role is to give them even more support. Can you talk about that?
Sure. So our hospice and most hospices really believe that it's important for people to maintain a relationship with the physicians that they've had throughout their life. Oftentimes people can feel a little abandoned as they might be approaching end of life and their physicians might be less involved in their care, and we really want to support that relationship as time goes on. So either it be it the primary care physician, the oncologist, the pulmonologist, whichever care team has been involved in that person's life up until this point remains involved in that person's life. And I act as a consultant both to the physicians as well as to our team to help support the patient and family so that they really achieve the comfort and quality of life that Shannon was referring to, and help try to coordinate all the different pieces of the puzzle to help that flow.
And to me, that's phenomenal, because all of the support of the caregivers and the family and supporting their own doctors and the oncologists, it's amazing to me, because that makes me feel even better about the care that they're getting. And that must be kind of fascinating and interesting to deal with these different situations. And I know you've been doing it for a little while now. How long have you been with hospice?
I've been with hospice 11 years this month.
Thank you for doing that. That wasn't on the question sheet. But I knew it had been a while, so I know you find this as a kind of a calling for you to help with this process.
It's the most rewarding thing I can imagine doing. If you want to help people live well, this is it in a nutshell. I love it.
I don't want to sound quite as repetitive as I can be, but thank you again for doing it. And I want to come back to you, Shannon, and ask you, with all the things that you help coordinate, from the volunteers to the caregivers, direct caregivers, there's always care plans written, and I know, Doctor, you help with that too. So every aspect of care is mapped out, yeah?
Yes, and it's individualized to the person and the family, what their wishes are, what their goals are, and we bring our services in to help maintain and to meet those goals, whether that be getting a steak from Ruth Chris's Steakhouse, or going outside and being able to walk from the bedroom to the living room, and maybe just staying out of the hospital for about 6 months. We provide all of that care and symptom management so they can meet that goal. And we do it so well, but very individualized with our nurses, our multidisciplinary team, and the primary care physician.
And I'm going to come back to a couple of things on that, because I just, again, spent some time with you folks and just really impressed with it. But one of the things that has struck me for a very long time working in this field is I've heard people go on hospice, and families and even the patients have said, maybe we should have gone on sooner or thought of it sooner. So, and I know there's no magic one answer for everybody, so I'm going to ask it, and you can answer it any way you can. When do you think is a good time for people to start thinking about going on hospice and starting that process of support?
So as we've been saying, the real mission of hospice is to help people achieve their goals, identify their goals, then achieve their goals, and to kind of balance the level of medical care that you receive and balance that with the quality of life that you're achieving. So those kinds of questions, excuse me, can be initiated very, very early on. Are you living the way you want to live? Is your medical care helping you live the way you want to live? Sometimes there are costs. You might be receiving a type of treatment that's kind of temporary, challenging. So very early on. And if that discussion is initiated way early with any type of disease process or care plan, then there's no really one day where all of a sudden it becomes time to talk about hospice. It fits into the natural progression as the goals of care shift more to, as Shannon was saying, prioritizing comfort and quality of life rather than the pursuit of aggressive and invasive therapies.
Sure. So it's all individualized. So let's say someone's decided this is the time and they contact you. How does it begin? What do you guys do to start off?
Like we've said in a few minutes ago, anyone can make a referral, or a phone call to hospice. We then in turn ask specific questions on what is going on at the moment with your loved one. And it may be the person themselves calling. Maybe they're saying and feeling like they can't do as many things as they used to be able to do. It's getting harder to take a shower, get out of the home to get groceries. They're calling for help. So we identify the primary physician that that person has, and then we make contact with them to discuss the phone call and obtain a referral. So it's a medical doctor's order. And then we meet with them. We meet with the person and the family to in turn see what's been going on within the last several weeks, what has changed, what can they do in the past versus what they can't do now.
Sure.
What do they want to get back? Identifying those goals with that person and family, and offering our services and marrying them up to make that plan of care that we were talking about, and how our services can do that and achieve the quality, the comfort, and that will maintain through the decline, the disease progression through the end of life.
I wanted to, I mean, I'm sure you could talk about so many different cases and so many different patients and how you've helped them and their families and friends. So if someone was interested in being outdoors, you might have a volunteer do what with them?
We may have a volunteer come in, which also gives that loved one a time to do errands.
Take care of themselves too.
Go to the grocery store, maybe go to a doctor's appointment. Our volunteer, if they like music, will identify those key pieces. So we match our volunteers specifically to the person who's having our services. So they have something in common. They can get quality of life, and they can just socialize. So it brings a part and a piece together through that care plan. We have multiple residents in long-term care facilities that just love music. We have volunteers that do music, play instruments. So we ask those key questions. What did your loved one like to do? And then we match them. And we're very specific. And we can do it several hours a week, once a month, whatever their needs are.
I think that's phenomenal. I have to say it's so impressive, and I know I've seen it in skilled nursing facilities, and just the joy that those folks bring. And we've done actually a show on your volunteers, and if you want to talk about some amazing people, I mean, I get kind of goosebumpy. You have one woman who just, I think, has the most energy I've ever met out of one person, and I think how lucky. And she told me she was the lucky one because she loves what she does, and volunteering is huge. I don't want to get cry on the show, then I get sniffly, so let's see where we are. So the individualized care plans, all the support, clinical, social, spiritual.
Yes.
And I think we want to talk about not just the patient, but the family and the support that they get. Do you want to talk about that?
Sure. So as we've said, the family does receive a lot of support. And just to clarify, the family is very self-defined. A lot of our residents in skilled nursing facilities, they've been there for a long time, and the people who've been caring for them, they may be employees, but they feel like family. They love them very much, and they can live there for 10 years or more. And so we support all of those people who might be connected. While their loved one is receiving care, we provide families with emotional support, spiritual support, non-denominational, in whichever fashion they feel comfortable with. We might help them, say, access services in the community that they might not have realized they were eligible for. As we've said before, the aides and volunteers who provide personal care, companionship, allow the family to take a little time for themselves, get out, do something that helps them feel like they can come back and continue to give in the way that they've been giving. But it also helps them step back a little bit and be a daughter, be a husband.
And that's a huge thing that they still need to be.
Right, whereas they may have been spending quite a bit of time being a nurse or caregiver, so it gives them that space as well. And they can also have one-on-one support from the social worker to help them figure out what they're going through and what's going to come next, if they so desire. Most of these services can come and go as people need. Perhaps when someone first starts receiving services, all these faces can be a little overwhelming, and then in a week or two they feel that they do need more support, they can get more support. So it's all very flexible based on the needs of the patient and their support system.
Yeah, totally impressive. And I've seen people evolve in what they need and are feeling comfortable, and I think that's natural, especially in these situations. But I wanted to thank you for bringing up the staff at a skilled nursing facility. And I've always felt that hospice care in the Berkshires is very aware of that these caregivers in this situation can be their friends and their families. And it's you've actually come in and done different support groups for that staff. And you'll go into schools and do that, and churches, is that true?
Yes, we will. That's part of our bereavement community bereavement portion, and community bereavement reaches so many different people. And what people don't realize is you don't have to have hospice services to be able to have community bereavement. And our community bereavement touches everyone in Berkshire County. We are the only hospice that offers that. And community bereavement can be for a loved one, sibling, child, unexpected death, a suicide. So we offer support groups, individualized one-on-one bereavement support, as well as group support groups. We have some in North County as well as South County coming this year. We also provide remembrance ceremonies in our long-term care facilities as well for people who are residents. Maybe there's been 4 or 5 different deaths on one unit. Our social work and chaplain will offer remembrance ceremonies for those residents. We have a remembrance ceremony for the community as well for our patients and our families to come back and see their aide and their nurse and their chaplain as well. So community bereavement is huge. But what we don't get the word out that we shared is you don't have to have hospice services to have our community bereavement support.
And I think it's, again, thanked you a bunch of times, but really what I want to do is get the word out because people need this support. And they don't know about it. So again, just like you said, anybody can refer. If you're watching this and you have a friend or a situation, refer. And how can they contact you? We're going to put it up on the screen.
All right.
So we don't have to say it, but you have a website. You're in the phone book. We're putting it should be up on the screen momentarily. But reach out to you guys because people don't, and that's why I'm going to ask you to come back again.
We'd be happy to.
I would be delighted to have you come back again, and much respect. And I'm going to ask people to not only reach out for support, but if they want to volunteer for you guys, that would be wonderful too. Absolutely phenomenal job. I can't tell you how glad I am that you came on today. We need to take a break. We're going to take a break and watch a little bit more about hospice care in the Berkshires. Thank you both for being on.
Thank you. Thanks for having us.
It's delightful to hear about the tremendous work that you guys are doing at hospice care in the Berkshires. All right, break time. When we come back, Dr. Deborah Reed.
Nestled in the center of the picturesque Berkshires of western Massachusetts, Hospice Care in the Berkshires has served the county for more than 30 years. Hospice Care in the Berkshires is a proud affiliate of Berkshire Healthcare, the state's largest nonprofit provider of nursing, rehabilitation, and senior housing in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hospice Care in the Berkshires offers comfort, compassion, and the emotional and spiritual support families and patients value when faced with life-limiting illness.
When my mother-in-law was diagnosed with terminal cancer, we had hospice come directly to our home. It's where she resided and wanted to have her care done. It was a tough time for the family because it was a shock to find out the limited amount of time that she had. But when we started working with hospice, they came in and worked with us wonderfully. They helped us navigate through all the administrative tasks. They told us about all the services that were available to both the patient and the family, the social workers, the home aides, the nurses, and really helped us get through this tough time.
Our caring, dedicated, and experienced team of professionals supports patients and families where they live. Whether it's at home, a nursing home, or assisted and independent living facilities. This team includes hospice-trained physicians, hospice nurses, family counselors, spiritual counselors, and hospice aides.
Oftentimes people ask us, why do you work for hospice? You know, why would you do this? Why do you work with dying patients? And I think most of the people on our team would say that it's an honor to work with people at end of life. It's an honor to try to support families and patients through end of life, to make sure that they are cared for with dignity, that they die peacefully, that their families are supported through that process. It's our goal to make it even a little bit better if we can. We can't change the outcome, but to be there and to support families through the process and patients through the process in every aspect is really important.
And we do try to support both the physician and the patient and family at this time in their lives in whatever location that patient and family want to be.
And I just knew that when I retired, I wanted to be part of helping people that were dying and didn't have someone to be there to support them. I knew that that's something I wanted to do.
Our incredible team of hospice-trained volunteers are instrumental to the support we offer families. Our team of over 100 volunteers helps with transportation to appointments, running errands, and respite for the caregivers.
When you know that you can make a difference and that person is secure and feels not as scared because they have someone to sit there to hold their hand, I just can't tell you, you just feel like you're floating on a cloud when you leave. And to be there when they actually die and to know that you've made it easier for them, you just can't explain that.
Hospice Care in the Berkshires is grateful to the many people who make donations. All the funds raised support the agency's community programs and services, an integral part of how we serve Berkshire County.
Bereavement services at Hospice Care in the Berkshires are funded through philanthropic dollars from the community, and that would include donations, memorial donations, and also community events that we have, such as our gala, our remembrance walk that we have every September, and that allows us to provide bereavement services to all members of the community, not just folks who were hospice patients' families.
I would definitely recommend Hospice Care in the Berkshires to other families. Again, the range of services was wonderful. In fact, I love the organization so much that I now volunteer and help other families who are going through it.
Choosing hospice isn't about giving up on life. It's about choosing the support needed in order to live a full life right now. For more information about how Hospice Care in the Berkshires can help, call us at 413-443-2994.
Welcome back to InfoSource, and as promised before the break, Dr. Deborah Reed, audiologist. Can you hear me?
I think so.
I can hear you.
All right, excellent.
Deb, I have it written down right here that you were recently voted Best Audiologist in the Hampshire Gazette's Reader's Choice Poll for 2015.
Yeah, that's a great honor. Yes, yeah.
Audiologist.
Audiologist.
Yeah.
Yep.
I wonder if everyone knows what an audiologist is.
So an audiologist is a hearing doctor. We specialize in hearing and vestibular healthcare.
I thought it was cool. Like, I had met you years ago, and all of a sudden you're Dr. Deborah Reed, audiologist.
That's right.
And I thought, I think ears are cool. And you must have thought ears were cool because you got into this line of work.
Yeah, well, when I originally met you back in the
day,
maybe the 90s.
We could have done a different show.
I was a counselor, and I was also a musician. I'm a percussionist. And then I was looking for a change where I could still stay in a clinical role, but get to play with music and sound more. So I went back to school and got my doctorate in audiology, and now I get to play with sound all day long and help people in a very practical way.
Do you see I got my mouth dry? Like, because I always like to ask people, how did you get involved in this line of work? And I could tell you how I ended up doing this. Yeah. And to go from a musician and to an audiologist.
Yeah.
I want to poll other audiologists and see, like, did you get into this for that reason? But that's a different show, a different time.
Well, audiology is said to be a blend of art and science, and so that's you know,
cool.
you have the artistic, counseling, clinical side of things, and then you have the technology and the very pragmatic side of things. So it's perfect for me and my personality. So,
yes, it really is. It's very cool. I mean,
hence, I won the Reader's Choice.
Because she's cool, people. All right. We don't have a ton of time. You've already promised to come back. We're going to do a whole show. You're going to bring stuff. We're going to look at my ears.
Yes.
Can I see my earwax?
Yes.
Oh, awesome.
Yes.
That'll probably be a highlight show. But what I want to say is, not only are you an audiologist with your own practice, but you have 2 locations.
Yes.
Where are those locations, Deb?
So I originally opened up an office in Hadley, Massachusetts, right on Route 9, and I just this past fall opened up a new location here in Pittsfield on East Street. It's right conveniently located across the new BHS Urgent Care Center.
Very nice.
In the St. Luke's Plaza.
You're a very good guest.
So,
You plugged
yeah.
the Berkshire
So,
thing, too.
well.
All right. So if someone's having difficult hearing, or maybe a family member, a friend notices someone, they should reach out to their primary care doctor, who reaches out to you, or
Yes.
can they call you directly?
They can call directly.
Okay.
They will need a physician referral,
Okay.
but we're happy to coordinate that.
All right. Top 5 reasons somebody comes to see you?
Every person you talk to mumbles. That's
Really?
a sign of a
somebody
hearing
else's
loss.
problem?
Yeah. So,
Deb, I might need to call you later.
so ringing in your ear, any ear pain. People are complaining that your TV volume is up too loud. You're having a hard time hearing in noise, or you stop doing activities. You stop going out to restaurants or meetings or church events because you
it's
can't
difficult.
hear. It's hard to manage.
And we've been kind of joking around, but I think the serious thing about it is people get used to, and so they don't realize. And I remember we had a conversation about it. Someone else will notice that they're having more difficulty. They keep turning the volume up on the TV,
Right.
and so they can do it. So they should reach out to you or the primary doctor and get it checked out.
Yes.
All right.
Yes.
And the show I want to do, we're going to give a little foreshadowing, because I was reading about different things, and it says, and you said, memory loss and
Yes.
dementia. So that is very interesting to me.
Yes.
So would you be willing to come back and talk about hearing loss and the memory issues and stuff like that?
Yes, I would love to.
We foreshadowed a new show. All right. So I want to thank Dr. Deborah Reed for coming
thank you for having me.
to InfoSource. And thank you for watching. InfoSource is a presentation of Berkshire Healthcare Systems. Thanks for watching.